Can you, to cap off this section, tell us one really sad story of an interpreter helping a patient and one really happy story of an interpreter helping a patient during COVID?
I don't think we can say one life that we lost was definitely tough because, as I said earlier, we knew that patient when they arrived in the emergency room and followed them through their sequence. And if they were intubated, if they passed during an intubation or something, we assisted in that communication with the family as well. I don't think there's one sad story because, unfortunately, COVID has taken too many people. And we've seen them. You know, you have the young, the old, the middle-aged. Nobody was immune. A lot of them were taken. So I think that we had was definitely hard. But on the other hand, not everybody died. And it was great to see patients who had been on high airflow or even intubated walk out of the hospital. Just being able to hear them all of a sudden say their name and respond to the doctor's conversation without struggling for air and just being strong again. Every single one of those cases was absolutely amazing. I wouldn't take either of those back. I think I learned as a person from both situations. I grew as a professional on both situations. So yeah, I don't think I could give you one, but that's all of them.
This is the closest I've come to crying on camera, but thank you for sharing. So from there, I would like to go into our final section, which we like to call the crystal ball. We were living through such a special time, as you've just elaborated on. What do you think is going to be better after the pandemic than before?
What do I see better? I think telehealth is going to bring a lot of access to some people who don't have it, who can't make it here. So many patients that struggle to get to anywhere that they need to, whether it's their clinic, whether it's the hospital. They have to take 2-3 buses to make it there. Sometimes it's raining, sometimes it's not, sometimes it's hot, sometimes it's cold. And in many cases, it's just, I don't want to call it a regular visit because there's nothing such as a regular visit, but it's a visit that can potentially be done via telehealth. I think telehealth is here to stay. However, I think one word of caution to anybody who's going to be using telehealth is if you feel that that's not the appropriate time to do a visit via telehealth, then patients need to voice that because sometimes there's more than just a follow-up visit. Sometimes it's more than just seeing a doctor for general visits. There's a lot more, and some things cannot be accomplished via telehealth, I don't think. Just like using phone or video cannot be accomplished for interpreters at all times. Some patients do need somebody in person. I think it's the same thing, but it's definitely here to help, to stay, and it's helped tremendously during this pandemic. The telehealth system is just incredible. I think it's the way of the future in so many ways.
Do you feel that telehealth was ready for COVID, or did COVID sweep over our preparation for telehealth and show us that we really were not prepared?
I really can't say much about MedStar. MedStar has had a robust telehealth system, and we had it set up. It just wasn't being used to the degree that it could have been used. And we just transitioned from one piece to the other very quickly. So I'm blessed to be working in an organization that had a lot of the prep work made for the telehealth system. However, the pandemic allowed a lot of those what ifs to come out and be able to show us what's best, not what needed to be tweaked, changed, or whatever it is. And that's throughout the country, really. It does make a big difference.
So I understand that at least the way that works for you at MedStar is that your team receives the requests and you have the telehealth support if you need it. Is there a team that's specifically dedicated to telehealth technology? Is it a general technology team that has a subdivision for telehealth? How is it organized that way?
And my understanding is telehealth is an actual department here at MedStar. So that's their focus. Telehealth is what they do. It's not a little bit of this and that. It is telehealth. It's a robust team. They've really done a ton of work with it. And with that, we were able to place the technology in our different units so that the patients could use it while they were here, not just to see a patient, but really a telehealth system was used in many different ways. So.
And in MedStar's case, that's physical units that MedStar has around the hospital that are able to be used for telehealth visits, and sometimes those would include an interpreter.
Yes, and the interpreter, they have, there is a link that you can get an interpreter on it. So an interpreter would be there, whether over video or just speaking, an interpreter would be available to those telehealth visits.
And I guess I'm still trying to see how telehealth system impacts your work.
I think it impacts the patient more than it impacts us as interpreters because we do not interpret for telehealth. So the impact is more for the patient in their options.
That makes total sense. And so the patients now have more options because of the telehealth implementation that's been rolled out throughout MedStar.
Yeah.
Okay. I will give my response a little bit to this crystal ball question from language access standpoint. From the agency side, I can certainly say that requests have gone through the roof for telehealth, phone, and video. So we've also seen, and this is just something that perhaps you could take back as well for comparison with MedStar, that from one organization to the next, nobody seems to have a unified way of implementing it. It's all different. And you must have seen this moving from one role to the next as well. The understanding that I had as well is that MedStar has done a fantastic job. I'd heard that as well.
Mm-hmm.
So we've certainly have worked with organizations who don't do such a fantastic job, or they're drawing at straws and trying to figure out what their next move is. We've seen a mix of preparation and lack of preparation for the pandemic, and it's quite interesting to follow. Now, we've spoken with companies, for example, like Air Visits, that is actually a virtual doctor's office. It's probably the easiest way to describe it. And man, the pandemic came and they were like, what pandemic? You know, we're rolling along and doing the same service that we always have, except, of course, they had a lot more doctor's offices that signed up for their service. We've also spoken to Sam Lipless, who's a telehealth advisor and implementation specialist. And she's given us her perspective that it hasn't been perfect. Some places have been really well prepared, and others are just kind of getting up to snuff. And others, you know, if you go on the more micro level, Sam has told us that, and then we've later corroborated that there are a lot of smaller practices or smaller hospitals that maybe even had to shut down because of their lack of preparation. That's quite sad. However, everyone seems to have the same consensus that going forward, we are heading in a direction where telehealth will be more and more useful. That seems to be unanimous, and that's fantastic to hear because it provides more access. You and I are aligned on that. Everyone I think that we've talked to so far on this series is aligned to the fact that whatever is required to give patients more access to the services and the care they need, and we're all for that. So I've got just a few questions from the Ad Astra staff. First question is from Ryan, our Chief Operating Officer.
What were the top 3 biggest pains or issues you had to deal with during the crisis that you know that other people in your same position in other hospital systems are having to deal with right now? What question did you need answered or solved that they will need answered or solved?
I don't think I would speak necessarily for only MedStar Washington Hospital Center. I think these are things that interpreting managers throughout the country would feel. It is not knowing that a patient needs our services and that patient going through their stay at the hospital without receiving service or without the option of getting it. In some cases, because either a family member is used, in other cases, because a staff member is used. But I think that's one of the biggest things that get us, because our whole role is language access. And if we know that there's a patient in the hospital and they call us for discharge, and we go, what do you mean they're discharging a patient who speaks XYZ language? You know that they've missed something during their stay. And if they used a family member friend, we know, one, were they accurate? Were they able to provide all the information? Did they understand? Did they give the information accurately, or did they interpret what they thought they should interpret? So I think that's one of the biggest things anybody in this position, any part of the country or even the world, inappropriate use of the phone or video service. I think there's some patients that should never use the system, whether that's somebody who's hard of hearing, not necessarily deaf, but somebody who is just elderly, who has lost their hearing because of age, or somebody who maybe is not fully cognitive about what's going on. There's certain services that would never be used with certain people because they're not going to be able to understand the information that is given to them as accurately as they should. I think that's number 2. Third one, I don't know, not being able to find the languages that we need. We really rely on video, phone, and agencies to get those languages. And sometimes the languages are so rare that we just can't find them. That is frustrating because we know that the patient is just not getting what they need. So having rare languages that we don't know about or that we cannot provide the services. And that's, I guess, common with new migrants to the area from countries that we have very low population in the area. Unfortunately, that's something that they fall into. Fortunately, with a phone or video, some of those languages we're able to bridge that gap. But in some cases, it may be difficult with the indigenous languages from any country. That's a huge issue.
Tell me a success story. When have you had a rare language that you're able to find someone for? How was it done? What do you think makes a difference in that hunt?
I think just the relationships you have with the agencies you work with are key, because as you start seeing certain languages pop up, being able to say, you know what, this is interesting. I've had this, or I've tried filling this a couple times and I have not been able to. Just really being able to have those relationships in which the agency is keen enough to say, wow, look, we've missed filling this many times. Let's actively or proactively look for something like this. And in many cases, that may mean, hey, I know you can't find this on the phone service that you have, but I was able to find it through our sister agency who works in this area or is able to provide this. So really having a relationship with any agency that you work with and being able to fulfill that, I think is key.
Just one more question. That's from John Eck, our head of recruitment and human resources.
What connections you as the language servicing team have with doctors, medical staff, and the clinics in general?
Our doctors have learned to work with us, have seen the benefits of providing the language services. And it's funny because sometimes when the new residents come and they see one of the interpreters, they say, and by the way, they're from the interpreting team. Make sure you don't see any patients without an interpreter. And I really think it's that relationship the team has had with the healthcare team in which they've been able to say, hey, we are one team. Let's work together, and it benefits everybody in the long run. So it makes your work easier. It makes the patients stay here better. So it really, once they know our number, they call us all the time. So we have a very good relationship, not just with doctors, but with nurses, with different departments. We truly have broken a lot of those barriers in the time that we have been here. So
that's great to hear. I can attest, Vanessa, just from what you've said in this interview, that you've come a long way to be able to make those relationships with the doctors strong, to get to the point where there's an overall understanding and acceptance that working closely with interpreters and the interpreting team provides better care, makes people more healthy, is something you should be very proud of. I want to say congratulations. And thank you for what you do. This interview series is really about stars of patient access. So we appreciate you very highly. Thank you so much.
Thank you. Thank you. And I have to say, I'm not alone. I would have never gotten here without the people that I have worked with and surrounded myself with. It's just truly an incredible group of people that I've learned something from every day.
So Vanessa Niño from MedStar Washington Hospital Center, thank you so much. And
You're
we'll see you on
welcome.
the blog.
Thank you. I'll see you there.